Wednesday. My name is Dr. Whitney Davidson, and I am a HealthyStart provider, and I work in BlueStone Dental. So recently I've had a lot of questions. What is HealthyStart? I've never heard of it. I have no idea what it does, and how can it be beneficial to my kids? So I wanted to take some time to explain what HealthyStart is, what it looks like, and why it can be beneficial. So HealthyStart is a functional appliance system. It's actually functional orthodontics, and it helps to basically allow the body to develop the way the body's meant to. So it really just aids and guides the body and lets the body do the work, which I think is very unique, but incredibly amazing as well, because our bodies are not meant to have malocclusions or crooked teeth. If our mouths develop properly and our maxilla and our mandible develops properly, we will not have crooked teeth. Isn't that neat? You know, we all know people that, wow, how can they have crooked, or how can they not have crooked teeth and they've never had braces? Well, their maxilla and their mandible develop properly. And there are lots of reasons why. So the first thing I want to talk about is why airway is so important, why a properly developed airway in children is so important, and what happens if that doesn't happen. So some of the problems with having a improperly developed airway or a smaller airway for children can be that they struggle to breathe, of course. You know, just imagine if you had a Slurpee straw. I think they're Slurpees, right? Or malts, I don't know, whatever. Big straw, okay? So if you had a big straw and you put that in between your lips and you were breathing through that big straw, you can breathe pretty well through a big straw. But you grab a coffee stirrer in a small straw and you try to breathe through that, it's very hard to breathe through that. It's very hard to get the proper air into our lungs, the proper amount of air. So this is kind of a similar analogy that if kids are developing a coffee stirrer straw airway, it's very challenging for them to breathe properly and get the proper oxygen. If you have a Slurpee straw, it's a lot easier to breathe. And so why is that so important? We know that when kids struggle to breathe at night, we know that they're not getting into the proper quality, they're not having the proper sleep cycling that they need to have proper health, proper development, proper learning. So it's really important that their body is able to hit all the sleep stages that they need to so that their body can heal, so that their body can develop, so that they develop or they have the same hormone releases, so they have growth hormone that is produced at the proper time, so that they grow taller, they grow, have muscle development. But more so, in addition, we need proper development to have our brains healthy and to have our kiddos being able to learn well and to function well in school. So some of the problems with having a poor airway and having a challenging time of breathing is, and here's a brochure, which I don't know if you can see. Oh gosh, there we go. Okay, so is a lot of things. So number one, anybody who knows a tired kid knows that kids aren't just going to fall asleep on I'm just so tired, I just got to go take a nap. How many kids actually ask to take a nap? Not mine, that's for sure. But my kids will get wild. They'll get hyper. They are bouncing off the walls, and they are rude, and they have poor behavior, and they can't focus. And let's be honest, they're little tyrants. They are just not real fun to be around. And they're not cooperative. And they just are struggling. We know that tired kids act wild. And research actually shows that half of the kids that are diagnosed with ADHD actually have sleep disordered breathing, which means they have that coffee straw stirrer airway, which means that they're not getting good oxygenation when they're sleeping, and subsequently they're tired. They are tired all the time. And then they're forced to go to school, and they're trying to stay awake, but they're acting out. So one of the things with having a compromised airway is that sometimes often there'll be behavioral issues. There'll be learning difficulties. There'll be, these kiddos will have maybe a tough time at school. Maybe they've even been diagnosed with ADHD. Maybe those kids are tired. Maybe those kids, and sometimes those kids will be, they'll have, dark circles under their eyes right here, as I do right now. But that's besides the point. But these kids also, they can have learning difficulties, and they can have, sometimes they'll be the kids that will fall asleep as soon as they get in the car. Oh, they're just so wiped out from our day at the park that they just fell asleep right away in the car. Well, that's actually not normal. Kiddos shouldn't fall asleep as soon as they get into the car. They should be able to stay awake. So that's one thing. Another thing that we know, that kiddos that have a hard time with sleeping, and therefore breathing while they're sleeping, is they'll be bedwetters. And I can tell you there is such a stigma with bedwetting, and I wish we could talk about it more. Bedwetting, it is not from poor parenting. It is not because this kid is not trying, and I can assure you that these kids are trying. They are trying so hard. They are embarrassed by this. This is something they don't want to do. And by the way, no amount of waking them up to get them to go to the bathroom will make them stop wetting the bed. They need help. They need help breathing. They need help with developing their airway properly and developing their maxilla properly, so that their body can produce what's called antidiuretic hormone, which actually will help us to not produce urine while we're sleeping. If we don't produce that hormone, which is something that happens in kiddos, if they're not getting into the proper stages of sleep, they don't produce the same quality of hormones at the same level and at the same rate, then they will have bedwetting. They may have poor growth pattern. They may have lots of other issues as well. So I think I've talked a lot about that. Obviously, you guys can see I'm hugely passionate about this. If anybody wants to talk more, game on. Contact me. I'd be happy, more than happy. And if anybody out there watching this would like a free, complimentary consultation with me, an assessment of any kiddos that you know that you worry, hey, boy, I know a kid that no matter how much sleep he gets, he has a hard time at school. And my gosh, he just was diagnosed with ADHD, but he does well in school, but he just has a hard time focusing. And oh man, yeah, sometimes he has bad behavior, but he's a good kid. If anybody knows any of those kids, if anybody knows a kid that has dark pooling under their eyes, venous pooling, those we call them allergic shiners. If anybody knows a kid like that wants a free consultation, I will give them a free consultation. I would be more than happy to look at your child and see, is the development of their maxilla, is the development of their mouth, is the development of their airway healthy? Is it appropriate? We can help. We can help, and I would be thrilled to help. I would be honored. This is such a passion of mine. I just can't say enough about it. So onward, I want to show you what the HealthyStart system looks like. So the HealthyStart system, like I said, is a functional appliance system. It is made up of a few different appliances, and the appliances are customized for each case, of course. The first appliance is called a habit corrector, and the habit corrector, I'll show you, is a really unique appliance, because not only does this help the kiddo to breathe better at night, but it's physical therapy. It's called myofunctional therapy, but it's a physical therapy, so to speak, for your tongue, your cheeks, all night long. It's amazing. So these kiddos, sometimes the most important thing to get our maxilla to grow properly is to get our tongues on the roof of our mouth. Our tongue is a kind of a mainstay for developing our maxilla properly. It's really cool. That with the eruption of our teeth, so our permanent teeth, our adult teeth coming in, is critical for our maxilla and our mandible to develop properly, and it's huge. It is the reason that we have a certain facial shape. That is true. The teeth developing and the tongue being on the roof of the mouth and the maxilla developing properly is what gives us this shape right here. And I can tell you that this part of our face is 100% due to whether or not those all coincide and are done properly. So a kiddo that has a poor eruption pattern, we call it, or as their adult teeth are coming in, if they're crooked, if they are angled, that will not allow the maxilla or the mandible to develop properly. So this appliance, what this appliance does, and there's a little bit of a shadow. Let's see if you can see this. Okay, so what this appliance does is this appliance is worn just passively at night. And I can tell you kids love wearing this appliance. Kids will, honestly, the kids that I know, my son included, will not go to sleep without it because it's so comfortable. This encourages the kids to breathe through their nose, which is highly critical. It's really important that kiddos are breathing through their nose for so many different reasons. But this also basically forces the tongue on the roof of the mouth, but in a really comfortable way. I have never had a child say, oh, I don't like that. In fact, quite the opposite. They want to wear this. So this functional appliance, this little tab that's right here, that's right by my thumb, so that is a ramp, and that is what the tongue goes on to. And then, I'm going to actually flip this around because this is backwards. So then you can see that this is the little ramp right here. Then it has these little tabs right here and right here. So the tongue fits right into this space right here. And these tabs, every time the child swallows, which they can swallow 1,000 times a night. So every single time they're swallowing, the tongue pushes on these little tabs. I'm having a hard time with this one-handed demonstration, but so it pushes on these little tabs, and that strengthens the tongue. So these lazy tongues that have not been forced to get onto the roof of the mouth and develop that maxilla are now suddenly being exercised, and now are suddenly being encouraged to do their job. Get up there, do their job, develop this maxilla, develop this kid's face. Develop this kiddo's airway. Let's get this kid to breathe better. Let's get this kid to grow better. Let's get this kid to have an easier time with learning and with life. So this is the first one. This first appliance gets worn at night until habits are improved or gone. So we actually often, I have my son, he's on month 3 of wearing this. Loves it. Like I said, he will not sleep without it. He actually will wear it during the day sometimes because it's that comfortable. So I usually like at least a month of just wearing this at night before we switch on or we move over to the C series or G series appliance, which is what I'll show you next. So the G series appliance is used for kiddos that have a few permanent teeth in already. Well, I should actually take that back. It's used for kiddos that have their first adult molars in the back. So usually once kids have hit age 6, we switch over to this, what's called a G series appliance. So this is what it is. And again, this is also made out of medical grade silicone. So it's flexible and it's very comfortable. So this is a prefabricated appliance. So another question that I get, people will say, well, okay, so this is custom made for my child. Well, it's custom fitted for your child, but it's a prefabricated thing. This is a totally different way of thinking. So instead of us making a custom made model for your child who has crooked teeth and maybe not the best developed airway, we want a prefabricated appliance that will allow and guide the teeth into the proper location and help widen that arch out to how we want it, how the body is meant to be. So this does not force teeth. This is not braces. This is not brackets. This won't torque this tooth this way or that. This helps guide the teeth as they're erupting into their proper slots. Now, does it shift some teeth that are crooked? Absolutely. And that is some torquing, and that is straightening. Absolutely. I'm not denying that. But more so the concept is that we want to help guide those teeth into the proper location. And here comes the mailman. So welcome, mailman. You get to be part of the conversation here. Hello, Mr. Mailman. Do you want to say hello? This is Facebook Live. Hello. Yeah, you have a wonderful day too. So we love the mail. We love the mail. So anyways, back to this appliance. So this is similar to the C series. The C series is the same appliance, it's just that we don't have the adult permanent first molars in. So this appliance is used as a functional appliance. So it's actually used, the child needs to wear this a couple hours during the day and bite into it. So that biting pressure is similar to the tongue expanding along that maxilla and helping to kind of push or expand that bone and help it to develop properly. And it helps those teeth to go into the location that they need to be to develop the maxilla and the mandible properly. So this is used for 2 hours every day. Now, and then usually once we're past the habit corrector, if all the habits have corrected, there's no bedwetting going on, we have better learning at school, and we don't have the venous pooling under the eye, so therefore the kids are getting better sleep. Once we've done that, then this gets worn at night. But that is why we have constant check-ins, and so we know when to go on to the next appliance. I often get asked, okay, well, how long does my kid have to wear this appliance? Great question. So usually the habit corrector we use for a couple months. Sometimes we continue while we use this G series appliance. We use the habit corrector just at night, this during the day, and this during the day, the actual active orthodontic part of it will be no more than 6 months. That's the longest it ever can be. But more average is around 4 months, sometimes less, of the active biting into it, getting the teeth into the proper location. I think that is amazing. I mean, when we talk about the average length of time for the traditional brackets and braces, now, don't get me wrong, there are certain cases that you have to have that, and I work with some phenomenal orthodontists in town here. We are really lucky in Duluth to have these outstanding orthodontists. I cannot speak highly enough of them. They are great, and we are very lucky to have them. But their average length of time of treatment is about 18 months, sometimes longer, sometimes 2 years, depending on, how things are going, how the torquing is of the teeth, and, how the alignment is going. This is no more than 4 to 6 months. Now, this does have to be used at night to help continue to guide those teeth into the proper position, but the actual active phase of it, of biting into it daily for 2 to 4 hours, is 4 to 6 months at most. I mean, that blew my mind when I found that. Now, I'm sure you guys are all wondering, okay, so, all right, so what are the results? Like, what can I do with this system? Let me show you, because I think the results are pretty awesome. Let's see if I can do this. Okay, so some of the results. So you'll see some of these malocclusions that go from these tremendous overjets to having this beautiful alignment. We have these situations where we have, let's see if I can kind of zoom in on this. So we have these situations where we have what's called an open bite. This right there, you can even see the tongue. This right there, this is a perfect airway case. This kiddo is struggling to breathe. Their maxilla hasn't grown. Their maxilla needs to be wider. This should be wider than this, and it's the opposite. Their mandible is wider than their maxilla. We want the complete opposite. But the problem is he or she is a mouth breather. They are sticking their tongue out. You can see we don't want that. We want their tongue to be on the roof of their mouth, like I've talked about ad nauseum, I'm sure. But we want that tongue back, and we want that tongue developing that maxilla. So we can take, with this appliance system, we can take this kiddo and not only get them to breathe better, get them to sleep better, get their bodies to develop properly, get their hormones to be developed proper, or to function properly. And we can get them to be something like this. I mean, that is mind-blowing to me. And I find this system to be just amazing. And I'm hugely passionate about this, as I'm sure you can tell. So I hope that this live feed, thank you for bearing with the mailman, but I hope that this has also clarified a lot of questions, because I certainly have been asked a lot of questions, and I'm thrilled. I'm so thrilled to answer any questions. I'm thrilled at the opportunity to be able to speak to you today. Now, as far as a lot of times people say, okay, that sounds great. Okay, how much is it? Hello, and now we have Emma. Hi, Emma is our new hygienist, and we are thrilled to have Emma. We love Emma. So a lot of times people will say, well, okay, that sounds great. All right, how much is it? What is this going to cost me? So we want to make sure, and I am adamant about this, I am so passionate about a child's health. My undergrad degree is in nursing. I can tell you that that is at the heart of me. I'm a very holistic person. I look at the whole body, and a child's health is, it's everything. In my world, it's everything. And I will do whatever it takes to make sure that that I can help as many children as possible. And if there's anything I can do to help, I am on board. So I don't want finances to be an issue. We have lots of different options. We do take insurance. We do offer this whole system at half the cost of traditional orthodontics, just an FYI, but I am hugely passionate about this. And I just want everybody to know that we will work with you. I promise you that. We will bend over backwards, and if there's anything that we can do to help facilitate this, let us know, because your child's health, any child's health, if we can have an impact on this, if we can help, that is exactly what we are here to do. So if you have any questions, if you want to listen to me yammer on some more, if you want any research articles on it, I've got gobs of them. I have lots of, I've had lots of education on airway. It's a huge passion of mine, like I've said, and I can tell you that it has such a tremendous impact on kids and adults. I certainly see what happens when kids do not have intervention early. They turn into the adults that I end up doing a lot of dentistry on, and I see suffering, and I see them not breathing well, and I see them ending up with sinus infections. I see them being my sleep apnea patients, and I can tell you 1 in 5 adults has sleep apnea. I mean, that's profound. That's amazing. That is terrible. And there are some terrible effects of sleep apnea, and it's really sad, because if we can intervene early with these kiddos, we can prevent sleep apnea. And to me, there's nothing more important in my life, in my career, for me to be able to do. And I'm honored to be able to provide this system. So if anybody's interested, please contact me. I am here to answer any questions. I'm here, like I said, to give free or complimentary consultations, assessments. I am here. Help those kiddos that you know. Help them. Send them here. If you know somebody that has been diagnosed with ADHD and you just wonder, oh gosh, I wonder, could it be that they're just not sleeping well? Could it be that they're just not breathing well? I think it's worth investigating that. I think it's critical. So help prevent these kiddos from having lifelong issues. Those sleep apnea patients, we can prevent this a lot of the times. Not all the times, of course. I wish we could, but we can, if we start early with these kiddos, we can help guide the proper development, just help the body grow properly. That's pretty awesome. So thank you. I appreciate everybody being here. I am honored. I could talk about this forever, as you can tell, I'm sure. So, but thank you for listening. I appreciate it. And if you want to contact our office, the telephone number is 218-606-1040. Give us a call. Thank you. Bye-bye.